As mandated by House Bill 4, passed by the 87th Legislature, Regular Session, 2021, the Texas Health and Human Services Commission, or HHSC, implemented changes to most Medicaid behavioral health medical policies. These changes allow for the delivery of behavioral health services by synchronous audiovisual or synchronous telephone audio-only technology, henceforth referred to as audiovisual and audio-only technology, if this delivery method is determined to be clinically appropriate and safe, and is agreed to by the person receiving the services. These changes took effect on September 1, 2022. To assist providers in understanding the changes, the Texas Medicaid and Healthcare Partnership, or TMHP, has created two easy-to-read infographics that highlight the services that may be provided using these modes of delivery. Each infographic shows the service group, service type, procedure codes for each service, and key information about additional requirements for delivering the service. See the video description below for links to the infographics. You can also find the infographics on the TMHP Learning Management System, which is linked in the description below. It is important to note that providers of behavioral health services must defer to the needs of the person receiving services. This means that the mode of service delivery must be accessible, person and family-centered, and driven primarily by the person's choice and not provider convenience. Providers must also provide services to Medicaid-eligible persons in accordance with accepted medical community standards and standards that govern occupations, as explained in Title I, Texas Administrative Code Section 371.1659. In addition, providers must deliver services, including delivery by audiovisual or audio-only technology, in full accordance with all applicable licensure and certification and regulatory requirements. Whenever possible, HHSC encourages face-to-face interaction, such as in-person visits and the use of audiovisual technology, rather than audio-only technology. Therefore, if providing services by audio-only technology, providers must document in the person's medical record the reasons for using that mode of delivery. To be approved by HHSC for audio-only delivery of peer specialist services, mental health targeted case management services, and certain mental health rehabilitation services, outpatient mental health services, and substance use disorder services, providers must have an existing clinical relationship with the person receiving services prior to delivering the services by audio-only technology. An existing clinical relationship is defined by the person having received at least one in-person or audiovisual service from the same billing provider within the 6 months prior to the initial service delivered by audio-only technology. This 6-month requirement may not be waived. The billing provider is also required to conduct at least one in-person or audiovisual service every rolling 12 months from the date of the initial service delivered by audio-only technology, unless the person receiving services and the billing provider agree that an in-person or audiovisual service is clinically contraindicated, or that the risks or burdens of an in-person or audiovisual service outweigh the benefits. The decision to waive the 12-month requirement applies only to that particular rolling 12-month period, and the basis for the decision must be documented in the person's medical record. The required in-person or audiovisual delivered service may be delivered by another authorized professional or paraprofessional of the same billing provider as the professional or paraprofessional who delivers the service by audio-only technology. The phrase, "same billing provider," refers to providers within the same entity or organization, as identified by their National Provider Identifier Number or numbers, if the entity or organization has multiple locations. The mental health targeted case management, mental health rehabilitation, and peer specialist services medical policies are grouped to allow delivery of any of the 3 types of service by audiovisual technology or in-person, to count toward the 6-month and every rolling 12-month requirements for providing those services by audio-only technology. For example, suppose provider A delivers a peer specialist service to Mr. Smith using audiovisual technology in May of 2023. In August of the same year, provider A determines it is clinically appropriate and safe to continue services with Mr. Smith using audio-only technology, and Mr. Smith agrees with this arrangement. However, Provider A wants to provide a mental health rehabilitation service to Mr. Smith in August, and not a peer specialist service. Since Provider A delivered a peer specialist service to Mr. Smith in May, Provider A may proceed with delivering the mental health rehabilitation service using audio-only technology, because the prior delivery of a peer specialist service by audiovisual technology fulfilled the 6-month requirement. Similarly, delivery of any outpatient mental health Medicaid service by audiovisual technology or in-person delivery may count toward the 6-month and every rolling 12-month requirements for providing certain outpatient mental health services by audio-only technology. Regarding the substance use disorder services medical policy, delivery of any substance use disorder Medicaid service by audiovisual technology or in-person delivery may count toward the 6-month and every rolling 12-month requirements for providing certain substance use disorder services by audio-only technology. For example, suppose Provider B completes an in-person psychiatric diagnostic evaluation of Ms. Robinson in September of 2023. According to the results of the evaluation, Ms. Robinson would benefit from individual psychotherapy services. However, Ms. Robinson has transportation issues that make in-person psychotherapy services difficult. Additionally, Ms. Robinson lives in an area with limited access to broadband internet, preventing the use of audiovisual technology. Provider B determines it is clinically appropriate and safe to provide psychotherapy services to Ms. Robinson using audio-only technology, and she agrees with this arrangement. Provider B would like to begin psychotherapy services in October. Since Provider B completed the psychiatric evaluation in person within 6 months prior to the audio-only delivery of services, the 6-month requirement is fulfilled. Therefore, Provider B may proceed with delivering psychotherapy services to Ms. Robinson using audio-only technology. For up-to-date information regarding policy and procedures for telemedicine and telehealth services, refer to the Texas Medicaid Provider Procedures Manual, or TMPPM, located in the Resources section of the TMHP website.